Hamstring injuries, what you need to know. A lot of talk in the media these days with high-profile sports players out with hamstring injuries, and as you're now seeing, with hamstring repairs done surgically. Let me give you some background information about the types of hamstring injuries that can occur and how they need to be managed. First of all, the hamstrings are a muscle or a group of muscles, or three muscles at the back of the leg, and I think I can show you some of these. So here you can see a picture of the hamstring muscles. So we're looking at the back of the leg here. This is the buttock region, and these are the hamstring muscles. So if we expand this area a little bit, you can see that we have three hamstring muscles. One that runs down from the bottom of your buttock down to the back of the knee here on the outside, which is called the biceps femoris. And then we have two hamstring muscles that run down onto the inside of the back of your knee, called the semimembranosus and semitendinosus. And they all start from one common spot up at the bone that you sit on, called the ischial tuberosity. And they're anchored in this area from a strong tendon that attaches to the area. So the hamstring muscle has a tendon attachment in the buttock and tendon attachments just below the knee, behind where the knee bends, and then you have this fleshy bit of muscle in the middle. So that's generally the anatomy of the hamstring, and the muscular portion is within the middle belly of the muscle, right in the middle of the back of the thigh. So hopefully that just helps you to orientate yourself where you are. As with all muscle injuries, we grade the severity of injury according to the proportion of fibers that are damaged. And so the typical grades are from grades 1 to 4. Grade 1 would be a small proportion of the fibers torn, and that would be maybe less than 10%. So these are the sort of the pulls that you feel a bit of a strain when you're running on, but maybe not too sure whether you can play on or not. So that will be a simple low grade hamstring strain, and that's usually a couple of weeks away from participating in sport if you have that kind of an injury. If there's a bit more proportion of the fibers torn, that's classed as a grade 2 injury. And then when we get at the other end of the scale, grades 3 and 4, grade 3 is a significant disruption, at least 50% of the structure is torn, and a grade 4 is a complete separation, basically like a rope snapping. Now, there's two aspects to hamstring injury. One is just the extent of injury, as we've described, so we can grade that according to the level of severity. But the second component is where the tear occurs, and that's another really important factor. And the reason that's relevant is that different parts of the structure have different healing properties, and the effects of damage in those areas is different depending on where it is. So if the tear happens in the substance of the muscle, in the fleshy bit of the muscle, the red bit to you and I, well, that is an area which does lend itself well to repair. So the areas where the muscle fibers have become torn, they do heal over and they do repair with more muscle tissue, unless it's been a recurrent, persistent kind of a problem. So that's probably the best area to have the injury, if there is a best area. And then it really comes down to how much of the fibers are torn. Then we can have damage where the muscle and tendon blend together. So that's technically a bit more of a slow healing area. It's called the muscular tendinous junction. And that's an area where there's lesser blood supply than in the fleshy part of the muscle. So damage and repair there is a bit slower to occur, because you're looking at different kinds of tissues. You have a mixture of muscle tissues and what are called connective tissues, which is the sinewy tissues that the tendon is made from. Then you can have damage actually to the tendon itself, and that where you hear most about that is where the tendon attaches onto the ischial tuberosity at the base of the the bum cheek or the butt cheek. So damage in the tendon in that area or down at the other end behind the back of the knee. Both of those are not good areas to have damage because a tendon injury tends to be more stubborn and slow, again for the same reason as the muscular tendinous junction, that there's lesser blood supply to that area. So it's slower to repair, and the healing qualities are compromised. And then you can have damage where the tendon actually attaches in onto the bone. These are known as avulsion injuries, and this is basically where the tendon gets ripped or pulled off the bone. And that's a more modern phenomena. When I started in physiotherapy 30 years ago, we never saw avulsion hamstring injuries, but they're much more common now with physical size and conditioning and strengthening improving the way it has done in recent years. So one of the downsides is that the structural attachment of the tendon onto the bone can be vulnerable, and we see that in rugby and in soccer particularly. So those type of injuries generally need surgical repair. So we'll cover some more aspects of hamstring injuries and diagnosis and treatment and rehabilitation in the following series of videos. But today I just wanted to set the stage about the types of injuries that occur and the influence of where in the area, where in the hamstring tendon complex, wherever that injury occurs, will have an influence on healing times and recoveries. And the decision nowadays is again whether one needs to go with a surgical repair or can conservative treatment be appropriate. So there are a number of factors which need to be included there. So that's some background information on hamstring injuries. I'm David Fitzgerald from Dublin Physiotherapy Clinic. I've been a practicing clinician for 30 years, so I have some experience with these kind of conditions. If you found the information helpful, please give us a thumbs up on YouTube and feel free to subscribe. And I'll see you again on another video. Bye for now.